My name is Robert, or to most people, Bob Andrews. I'm chair of the board of trustees of NLHS. It's my sincere pleasure on behalf of the board to welcome you to Newfoundland and Labrador Health Services Annual General Meeting. Today, as is our duty under the Provincial Health Authority Act, we will provide an update on the progress, accomplishments, and challenges experienced during our second fiscal year as NL Health Services. The next step in the meeting is to do the land acknowledgement, and that will be done by Dr. Francine Lemire. Oh, I was looking everywhere, Francine. I didn't see you.
Do I need to use what you got around your neck? Does it matter?
Oh,
I don't know.
here, I'll stand close to you.
Okay, all right. Morning, everyone. We acknowledge that the lands on which Newfoundland and Labrador Health Services are situated are in the traditional territories of diverse Indigenous groups, and we acknowledge with respect the diverse histories and cultures of the Beothuk, Mi'kmaq, Innu, and Inuit of this province.
Thank you. I welcome everybody joining us today, both in person and online. The AGM is being recorded and will be available on the NL Health Services website, a bestseller, I'm sure. For those unable to attend, after the meeting, we will open the floor for questions. If you're watching online, please email your questions to agm@nlhealthservices.ca for a Q&A session, and our moderator will read these out at that time. I have some special acknowledgements of those amongst us. First, I begin by extending a warm welcome to our incredible employees, physicians, and volunteers across the province. On behalf of the Board of Trustees, thank you for your dedication, compassion, and resilience as we continue our journey as one provincial health authority. Also give a big thank you to our health foundations and auxiliaries. Your generosity makes a real difference for patients, families, and communities. I'd also like to acknowledge the chairs of those organizations joining us today, whether in person or online. Now, the punishment for the Board of Trustees. I would like to recognize my colleagues from the Board of Trustees who are joining us today. I'm going to introduce them, individually if they'd rise when their name is called, just so you can see who it is, and they can sit right back down. So, first, Lloyd Walters, Vice Chair. From Corner Brook, Michelle Bakey from Happy Valley Goose Bay. Sharon Forsey from St. John's, Ed Gowdy from St. Anthony, Dr. Colleen Hanrahan from Witless Bay, Tara Lang from St. John's, David Oxford from Grand Falls, Windsor, and Dr. David Sutherland from Grand Falls, Windsor. Board members attending virtually are Dr. Catherine Bradbury from St. John's, Candace Matthews from Port aux Basques, the Honorable David Peddle from Gander, and David Thornhill from Torbay. We also have newly appointed trustees from the Regional Health Councils. Again, I'd ask that they rise when I say their name. In person, we have Beverly Griffiths from Paradise, Dr. Francine Lemire from Corner Brook, Karanmi Price from Churchill Falls, and attending virtually Alvin Banfield from Vale Argent and Steve Crew from Hermitage. NL Health Services is guided by a dedicated board of trustees. There are no shrinking violets, is what I say about this board all the time. Believe me, they speak their mind. We're all leaders from all parts of our province and from diverse backgrounds and skills who bring wisdom, passion, and commitment to their role. Thank you for your leadership and your service and your full participation. We also welcome the chairs of members from each of the regional health councils. Thank you for your contributions. Next, I'm pleased to welcome Dr. Pat Parfrey. He just disappeared, I mean. No, you hide behind Sharon, I couldn't see you. We've been playing this game all morning. Next, I'm pleased to welcome Dr. Pat Parfrey, who is participating in his first AGM as CEO of NL Health Services. It's been a pleasure working with you and using the Health Accord, of which you are an author, as our guiding document. I look forward to advancing healthcare and improving health outcomes across the province as we go forward. As well, I extend a heartfelt thank you to our executive team. Your leadership, wisdom, and effort continue to be a driving force behind our programs. They're second to none. But most importantly, I sincerely and wholeheartedly welcome members of the public, patients, our families, community partners, and the media who have joined us today. Thank you for attending, and thank you for your interest in our healthcare system. As is required and customary at all annual general meetings, we will now move to the next order of business, the approval of the 2023-24 fiscal year AGM minutes. At this time, I'm seeking approval of the minutes of the 2023-24 AGM held on September 27, 2024. Do I have a motion? Thank you, Ed. Seconded? Thank you, Colleen. Now I'd like to invite Ms. Sharon Forsey, Chair of our Finance and Audit Committee, to present the financial report.
Thank you, Bob. Welcome, everyone. Mr. Andrews, Dr. Parfrey, fellow board members, invited guests, and staff. I am pleased to present for adoption the annual general meeting, the financial statements for Newfoundland and Labrador Health Services for the fiscal year ending March 31st, 2025. These financial statements have been audited by the Office of the Auditor General, and I am pleased to report the auditors have expressed an unqualified opinion on the financial statements. For the fiscal year 24-25, Newfoundland Health Services cash-based operating expenses were $3.8 billion. Of the $3.8 billion, 74%, or approximately $2.8 billion, was spent on direct patient care, and approximately 14%, or $0.5 billion, on indirect patient care functions. The other areas of expenditure included support, admin, research, and education. A detailed breakdown of NLH Services financials can be found in the operating revenue and expenditure section of our annual report, as well as the full financial statements, which is available on the website. During the fiscal year 24-25, NL Health Services incurred an operating cash surplus of $13 million. I would like to take this opportunity to thank the over 23,000 employees and physicians, including our new CEO, the executive team, and staff for their work and dedication. I would also like to take this opportunity to thank the members of the Finance Committee and the Board of Trustees for their support and commitment during the year in overseeing the finances of NL Health Services. Mr. Andrews, for the upcoming fiscal year, the Office of the Provincial Auditor General will be auditing our financial statements. Mr. Andrews, I move the adoption of the audited financial statements for NL Health Services for the fiscal year ending March 31st, 2025. Do I have a seconder?
I do that.
Okay, all right.
Sharon struggled with the Mr. Andrews because we're not usually that formal, and we've been doing this stuff together for a few years. And I'm supposed to say thank you, Miss Forsey. If you want this to be genuine, thank you, Sharon. We have a motion made by Sharon. Do I have a seconder? Thank you, David. David Oxford. That's the real business part taken care of, and we have to tick the boxes. I'll share with you a few of the many highlights and partnerships from 2024-25 fiscal year. This year there were two major infrastructure milestones. I don't recall the previous time we had two such large milestones in the same year, but the new 102-bed mental health and addiction center opened April 13th with private rooms, shared spaces, and modern therapy areas. It marks a major step forward in our mental health and addictions care in this province. The previous center, the Waterford Hospital, was originally built in 1855. Takes us a while to get around to replacing things, I guess. My career on boards actually started as chair of the Waterford a long time ago, but it wasn't 1855. Also in June 2024, NL Health Services opened the new Western Memorial Regional Hospital in Corner Brook. The 164-bed facility provides quality care and state-of-the-art treatment rooms and enhanced diagnostic systems. Next, we are proud to share that 93% of the local nursing graduates chose to join NL Health Services over the last fiscal year. Across the province, 203 Bachelor of Nursing grads and 167 practical nursing graduates have already started their careers with us. We continue to recruit internationally educated nurses and support their transition to practice in this province. We welcome 28 new nurses from Jamaica who completed the bridging program at the Centre of Nursing Studies. To date, 224 internationally educated nurses are now working in communities across the province. Over 150 more are expected to arrive throughout the remainder of 2025-26. We are proud to note that the practical nursing program offered by the Centre for Nursing Studies has received a 7-year approval from the College of Licensed Practical Nurses of Newfoundland and Labrador. This is the highest rating possible. The program received a perfect score of 100%, reflecting their excellence in preparing the future generation of nurses. This year, we launched our accessibility plan to help build a more inclusive healthcare system by reducing barriers for people with visible or non-visible disabilities. The plan will guide improvements. Also, to better support French-speaking patients and staff, we launched a provincial linguistic data strategy by integrating language data into the new Core Care Health Information System. We can better match Francophone patients with French-speaking providers, helping provide more equitable access to care. As you heard moments ago, we've made significant strides in expanding family care teams, a team-based model of care across the province in 2024-25. Family care teams are central to improving access to primary care, especially for individuals without a regular provider. This year, virtual primary health care services were integrated with 4 family care teams at team sites in the Eastern Rural and Labrador-Grenville zones, making care more continuous and accessible. Additionally, 19 physicians affiliated with the family care teams and standardized care pathways were hired to support the optimal outcomes of these teams. These efforts reflect Newfoundland Health Services' commitment to rebalancing care delivery and strengthening community-based services. We've also made improvements to timely access to cancer care. We launched NL lung screening pilot to am I using the computer secondhand, am I? We also expanded the provincial breast cancer screening program to support earlier detection and treatment. Screenings now start at age 40, and individuals from age 40 to 74 can book appointments through their primary care provider, or self-refer, making it easier than ever to access the service. Additionally, virtual primary care is now more accessible across the province. People can connect with Canadian-based doctors and nurse practitioners by phone, app, or computer, making it easier for patients to receive care. For example, it helps cut down on travel time. The board had the privilege of viewing this system firsthand in Flowers Cove a few months ago. And when they told me who they were talking to in Toronto, it was the doctor I'd sat on a board with at Hayrock. And I mean, this was no rookie. He was the president of the hospital at one point. So, you know, when they use those services, they're connecting with proven and certainly recognized experts in the areas that we connect to them for. But it was interesting to be in Flowers Cove. As part of the thing too, they had a little robot that was the same one I'd seen in Saskatoon about 2 years before. So it's the same technology right across the country, and it's well, it's sort of space age to me, you know. I have all I can do with a laptop. Anyway, it was interesting. In terms of innovation system improvements, Newfoundland Health Services completed an expansion of the Provincial Medical Communication Center in late 2024. The new facility supports the integrated ambulance services by providing space for training, debriefing, and rest areas. When I was given a bit of information on that service and listened to Dr. King's comments today, it struck me this is another way to expand accessibility to top-level healthcare further out into our province. And amongst the other benefits and efficiencies, it also provides continuous contact between the ambulance, the patient and caregiver, and the communication center. The same person dealing with the patient from the time they get into the ambulance till the time they're delivered to the hospital and turned over for service there. I mean, it's got to be a huge improvement and a huge comfort to people living in rural areas and wondering what they're getting. Before, it was all very much to the standards of the various operators. Now it's a totally integrated system, and I think if we think about that more, we'll think of more and more ways that's helping us in a province with such geography and such a dispersed population. So I'm very excited about that one. We've also introduced Halo telemonitoring in 4 Eastern Rural Zone hospitals, helping prevent 102 incidents like falls and oxygen mask removals. Using bedside cameras and real-time alerts, the technology supports a safer care. At the new Western Memorial Regional Hospital in Corner Brook, we have introduced a cutting-edge track system to improve lab services. I haven't seen this, but it sounds intriguing for anybody who hasn't heard about it. This robotic technology moves samples from drop-off to analysis, boosting speed and efficiency. Western Memorial is the second hospital in Canada to use this advanced system. And I get visions of R2-D2 and this sort of stuff. And given the past year, over the past year, all 42 medical imaging sites across Newfoundland Health Services underwent on-site assessments through Accreditation Canada, and all 16 mammography machines have achieved full accreditation from the Canadian Association of Radiology. We've had great collaboration with our partners over the last several years in the development of innovative solutions for patient service and service improvements. In October 2024, we announced 7 new innovation partners: AstraZeneca Canada, CGI, Ernst & Young, PhoneMed North America, GSK, Roche Diagnostics, and Trudell Medical. We also renewed 13 strategic innovation partnerships. These partnerships have resulted in enhanced patient care, improved health system efficiencies, and economic growth. Our successes with innovation have resulted in Newfoundland and Labrador Health Services receiving the 2004 Edge of the Year Award. This is a National Innovation Award from the Coordinated Accessible National Can Health Network. It recognized consistent engagement and participation in Can Health Network initiatives at all levels of the organization and our commitment to developing Canadian innovation. Receiving the award highlights NL Health Services' dedication to leveraging innovation to enhance health outcomes, drive efficiency, and foster economic growth in the province. What I've shared today is just a snapshot of some of the progress we're making. There are many more important initiatives that we're undertaking over the last fiscal year, far more than we can cover here. But with the continued support of staff, physicians, and volunteers in government, we will continue to build on the important work started to further improve health and health outcomes for the people of the province. We definitely welcome change. We have had, since NL Health Services came into existence, and largely because of the Health Accord, a mantra that we are open for business as far as any change and any open to ideas that will complement our system. With that, I call on Dr. Pat Parfrey, who's been the engine behind a lot of this change.
Thank you very much, Mr. Andrews, or Bob, as your mother would call you. I'm addressing my remarks to the board and the leadership of NLHS, but in particular, I'm delivering them to the 23,000 providers and workers that we've got working for NLHS, serving 545,000 people who are dependent upon us to deliver care across the 3 pillars of acute care, community care, and long-term care. And in particular, I'd like to compliment those 23,000 people for adhering to our organization values of innovation, compassion, accountability, respect, and excellence. And I'd like to remind everybody, particularly the 545,000 people who depend upon us, that we've only just started our journey. I'll just remind you that the Health Accord is a plan that our system has that we have bought into, that the strategic plan for NLHS is built on the Health Accord, and everybody can read it and see what that plan is for the next 5 years. In fact, it was submitted 3 years ago, 2022. We provided a provincial health authority in 2023, April of 2023. We're on this, we just finished 2 years of that provincial health authority that had the responsibility to develop operational policy for every intervention that we deliver a provincial policy that would allow equity of access to all our interventions of every resident of this province. That's our ambition. And on top of that, we have got a zonal healthcare delivery system that functions in such a way as we should be providing the care that people in those zones can influence and bring to the board and to the political system to try and influence the care they're getting. That provincial approach married to zonal delivery of care is a challenge, and we're constantly getting better at meeting that challenge. So there's lots of information out there about where we are from the Health Accord's perspective. We made a presentation, I made a presentation last month. You can get it online through our website. And what its job was to update us on where we were with the 59 calls to action from the Health Accord. And the report said that the majority of those calls to action are already in the process of implementation. And the remainder have the policy development so that we will soon implement the rest of them. That is amazing. And I can keep reminding you that we are only 2 years of delivery of those calls to action from the healthcare delivery perspective. And when you look at our annual performance report for 2024-25, we should all be proud of what we've done. The number of changes that have been made certainly gives people the heebie-jeebies. The 23,000 is saying more change. The reality is, despite the fact that we're in a plethora of changes, we are trying to implement those changes, and we're making a difference. So are we making a difference? Is it feasible to say that within 2 years of the Health Authority being started, that we're actually making a difference that people can feel? So let me just go through a number of strategic areas and mention just whether you actually believe me that we should feel that there's been a benefit. So we really wanted to move care into the community as much as possible. And that meant that to give people in the community the confidence we were doing well, we needed to have family care teams functioning with people having access to the continuing care in their community. And we needed to have an ambulance system that the confidence could get them to a hospital when something bad happened to them. We now have 20 family care teams in various phases of implementation with people hired. We have 2 more family care teams recruiting, and we've had 3 more confirmed in the last month, and we will have the rest of them funded over the next year or 2. The implications of those family care teams is that nearly 85,000 people are now connected to a family care team. Imagine, 85,000 people. There's another 25,000 to 30,000 affiliated through their the fee-for-service practices, which means that we've got nearly a quarter of the population connected to a family care team. That's big, I think, to be honest. The wait list that for being connected to a family doctor the data is from Patient Connect. At a peak, we had 96,000 people wanting to get a family doctor. We're now down to 42,000 people. That's success. And then on top of that, we're now leveraging virtual care in areas where we haven't been able to provide the human resource. In Category B emergency rooms, where the number of diversions that we've had for close down of emergency rooms in these areas has virtually disappeared as a consequence of us being able to put in good primary care and improved training for nurses who were serving those emergency rooms. That's big. And then the ambulance system, which was fragmented across multiple private owners of ambulances across the province on the ground, has been integrated on the ground and is already functioning and getting better bit by bit. And we've just had a contract signed with Medavie to be able to manage the air system and to be able to do something that Bob mentioned, which was to have a doctor available to a patient in an isolated area that can diagnose and help the provider with that patient, follow the patient from the time they're rung in to getting to the hospital, get the asset sent to collect the patient, and organize the bed. That medical transport physician is going to make a massive difference to people living in isolated areas and less isolated areas. So the capacity for our integrated air-ground ambulance system to make people feel more secure in this province is going to get better and better each year that this is going to go forward. So on the hospital side, I'll just pick out a few things that would make you think there's a difference. So in the cardiovascular and stroke program, we've had waiting lists of 200 for cardiac surgery. We've not achieved the benchmarks that we'd really like. We've recruited more cardiac surgeons. We've got a more effective cardiac surgery team. Our wait list is now down to 135, and we're now achieving national benchmarks. People who need cardiac surgery feel a difference. We've got transport systems to bring people from more isolated parts of the province to the cardiac surgery program, or the cardiac program, Heart Force One. Ways of bringing the air ambulance system has now got a protocol for bringing people who've got an acute myocardial infarction that needs a cath. All that is now present. On top of that, non-invasive surgery methods for somebody with an aortic valve that would have required their chest being cracked open, massive amount of morbidity, has now been replaced by non-invasive approaches to it called TAVI. That number was about 25 2 years ago. It's now 135. So you can see that in that program, they're living the tenets of the health accord and making tangible differences to the people in the province. The other area that I would like to mention is the surgery backlog issue. And we've picked priorities based on the federal government's determination of what our priorities: cancer surgeries, coronary artery bypass grafting, knee and hip joint replacements, cataracts, access to imaging procedures. And the report on the hip and knee replacements is that we've gone up massively in the last 2 years, from 1,600 in 2022 to 2,700 now. And we're beginning to break in or knock off that wait list that really is too big for the province here. Cancer care, we have the highest cancer mortality in the country. It's not driven by inadequate treatment. We're as good as anybody in the country for treating cancer. It's due to the incidence of cancer, colorectal cancer and breast cancer, etc. And we've now enhanced screening programs to try and either decrease the incidence of a cancer or intervene at an earlier phase in an effort to be able to decrease that burden of cancer mortality that we've got. Those things I'm mentioning are the big killers. They're cardiovascular and stroke, cancer. They're the big killers. Then, of course, there is on the community side, on the hospital side, we've started acute care of the elderly units, and there's a big push on to have senior-friendly hospitals and senior-friendly clinics. And the experience we have of the Corner Brook ACE unit is excellent. 78% of people who were frail and elderly who go into this ACE unit in Corner Brook go home. That's excellent. We've just started another ACE unit here in St. Clair's in the last month or two. And there is a ferment of work ongoing to try and improve the health of older seniors, both in hospitals and in the community and in long-term care facilities. Another piece that's an issue for us, I suppose, is that we have our hospitals are over 100% occupied. So that means our emergency rooms are blocked, that it's slow to get into hospital. People feel this. We've now got investments that are going to occur and we're going to implement to try and increase the number of beds available for what we call transitional care, i.e. care that occurs after your acute care is done. Now you're over the acute care, you're not ready to go home, you really need particular interventions to allow you to go home and allow you to be mobilized to go home. We're going to be able to get into that arena to a much greater extent than we have. So I think that the areas that we're dealing with, there are tangible differences to the healthcare delivery in this province. We are beginning to transform our system in multiple different ways. Our people are critical. Our people have gone from COVID and all the stuff that engendered, despite being tired, being able to deal with this change that's occurring in every single arena of NL Health Services. And even though they whine about it every now and again, the fact is we're doing it. And it's a credit to the 23,000 providers that we've got. We're trying to improve access, we're definitely trying to improve quality, and above all, we're trying to improve health equity. And by that I mean that every resident of this province has the capacity to access the interventions that we deliver as a health authority. One of the big changes that's going to, talking of change, and there's more coming, for the 23,000 providers, we're going to bring in a new health information system. And that health information system will, believe it or not, transform the way we do work for everybody, the patients and the providers. It'll allow us to be more efficient. It'll allow us to be able to be more appropriate in the care that we deliver. It'll help patients get at their data and at their appointments and at their follow-ups far more easily. So the story that that somebody was telling us about coming in, and they already know the result of the x-ray before the doctor knows about the x-ray, that's going to get worse. Thanks be to God. So core care is going to have a big bang rollout in every clinic, in every hospital in this province on the 25th of April, 2026. And it'll be a big lift, and it'll be a big change, but we're going to do it. I suppose it's not reasonable to mention financial sustainability. There is no doubt that financial sustainability is a really important thing when you consider that the deficit of the province has gone up to $600 million, that we spend 42% of the budget, that we are growing in the amount of money we're spending on healthcare because of all the changes we've literally bought into, and that there is a capacity for us to be more efficient in the way we do work, which will only occur if we focus on it. So our belief is that we must target financial sustainability as a province, and that NLHS is part of that solution. And we have got 5 areas that we're focusing on. One is an endeavour to provide value for the money that's been spent. So we're able to say what we're spending it on and what our productivity is. That we compare to other efficient units across the province, across the country, which is called benchmarking, and that we will get more in line with other provinces. That we use our human resource spending as well as we can. And by that I'm meaning that we're able to effectively work without undue overtime and with undue constant care. And that another opportunity that we need to get involved in is around the area of what I term unnecessary testing and interventions, which relates to the fact that we have the highest rates of use of interventions that are being scientifically proven not to provide that much benefit. That's going to be a big challenge because it's going to change the culture of the way we deliver care and how we influence it. They're the 5 areas that we are going to work in to enhance financial sustainability. Clearly, we need to strengthen our relationships with Indigenous communities. No shadow of a doubt. I'll remind you that the National Day for Truth and Reconciliation is the 30th of September, and that we as an NLHS are committed to trying to enhance care delivery to the Indigenous nations. I'd also like to reiterate that we are an organisation that wants inclusion. We need to work hard to enhance inclusion. That the idea that people with, or people, the LGBTQ community have worse health outcomes than people not in that community, that people in Indigenous nations have worse outcomes, people with disabilities have worse outcomes, that is just not reasonable for those people. And we've got to work on being able to be inclusive and to be able to work that their health outcomes are improved. So I think I've taken enough time. I could go on for a few days if left at it. But just to say to the 23,000 employees that after 2 years of NLHS, we probably should smell the roses and think that we've done good, because I definitely believe it. Thank you.
Who here doesn't think he believes that? Believes it and lives it. But, oh, right. Sean, are these cheaper by the dozen? Maybe we should know. Anyway, this board has traveled sort of every alternate meeting to the various parts of the province where we provide care. And what we have found, and I don't know, we attribute it to the adversity of COVID having been just over, or to the health accord, but we found acceptance to change everywhere. I've been a little too before sitting on these boards for a long time. It's over 40 years. And I've never seen that sort of sentiment before where there always seemed to be a little competition or a little something, a little resistance to change. Not that anybody is laying down playing dead or anything like that. There are people saying, well, maybe you should do it this way. But we found general acceptance and a willingness to deal with change throughout the province, which is very, very helpful. And when we go on those meetings, we meet with the local town councils, and we meet with the physicians, we meet with citizens groups, so we get a feel, the real chance for some real grumbling about what's going on. But you come out of them, and no offense to doctors here, but one was a meeting with a bunch of doctors, and a bunch of doctors meeting with a health board usually means there's going to be a million complaints. When we came out of the meeting, about an hour and a half, 2 hours later, I said to someone else, was that a bunch of doctors we just met with? Because it was so positive. The entire meeting was suggestions of things we could do to help in the area, which was fabulous. So that sentiment is there, and I hope that it spreads. I hope people can be positive about trying to help make these changes as successful as they can possibly be. The Newfoundlanders have the reputation for knocking everything at home and everything on the mainland is better. Is not so. Because of my national involvement over a 10-year period, I've seen every healthcare system in Canada up close. Had first-hand experience with the one in Ontario. 30 years ago, sick kids in Toronto couldn't communicate with Toronto Western because they didn't have compatible medical or computer systems. So I had to take an MRI and walk it over to Toronto Western so we could get it dealt with so they could finally read it, because they were doing surgery on Monday morning on my daughter. to my knowledge, they're getting around to getting that fixed. It was 30 years ago. So every healthcare system in the country has issues of one sort or another. And there will be little pockets where maybe something didn't get done because maybe the importance of it wasn't appreciated. But I'll tell you, our health system here is as good as any in the country. There may be some specialties we don't have, but we have connections to get that done as well. So get behind it and support it. You know, you can suggest something changes without saying everything is terrible. And you know, the 23,000 people that work with NLHS should be able to walk with their chests out because that's where they work. Because the people appreciate what they do, and I think the people should appreciate what they do. And that's not me, that's the 23,000 that are hands-on and providing service. Anyway, that's my lecture for today. Thank you to everyone for joining us for today's annual general meeting. We appreciate your interest and support and encourage you to review the 2024-25 annual performance report available now on the NL Health Services website. Before we get into our questions and answers, I just want to highlight that the AGM is a forum that is open to the public, and we do have people online as well as in the room. There are some limitations, however. If you have a personal question or comment about your experience or care or that of your family member, I would ask that you please submit. There are numbers supposed to appear on the screen any moment. I would ask you please submit those to our patient relations office so that the matter can be reviewed and addressed appropriately. Whether you have compliments, concerns, or suggestions, they will follow up to ensure you receive the support you need. I would have to point out here we are working on a provincial number and email for NL Health Services. You can see these are all in the old zones, which will be launched in early October. I assure anyone who wants to reach out that the existing numbers and emails that we have now will automatically be rerouted to new ones for a period of time, so you don't need to worry that there'll be a change made. It is also important to acknowledge that we are in the middle of a provincial election. During this time, NL Health Services will remain focused on fulfilling its mandate and continuing business as usual operations and sharing factual information and updates about the progress of our work and the availability and status of our services. To support the integrity of the ongoing election, we will not be speaking about new unapproved policies, programs, and initiatives. We will refrain from speculating or commenting on future decisions or political matters. This is a protocol generally recognized in most democracies. I'm not sure about the United States. We ask for your understanding and welcome your questions at this time. For those in attendance here and online, please raise your hand before you speak, and a microphone will be brought to you. Thank you very much. Questions? I should have commented when I was going through those highlights. I had not seen those 11 presentations that we had earlier today. And, you know, we were just touching on a little fringe part of that, and that is only a small portion of what is being done. But, you know, thank you for those presentations. They were fabulous. And clearly they answered all the questions. If there are none, I'll entertain a motion to adjourn. Thank you, Lloyd. Thank you very much.